For the first time in 15 years, tuberculosis cases are up in Arkansas this year. State Health Department says it has recorded more than 100 cases so far this year.
The fact that we're seeing a rise is not a cause to panic, but it is certainly something that I think would be important for the state health officials to try and examine the reasons why this is going on.
Dr. Upton Siddons with the Baptist Health Clinic in Greenwood says what's puzzling about this is that tuberculosis has been eradicated in this country.
We've essentially eradicated it to the point where we no longer need to vaccinate for it. However, we still have little pockets of it that can pack up every once in a while. There are certain areas which it is more prevalent.
He does say, though, if left untreated, it can be very dangerous.
But the fortunate thing is that with our modern types of antibiotics, it is definitely a treatable disease. The important thing is identifying it and stopping the contagion.
As far as getting vaccinated,
It's not commonly used here simply because we live in a day and age in which we've largely eradicated tuberculosis from this country. So rather than annually vaccinating the population or vaccinating everyone at birth, like we do with some diseases, we're able to really focus on stamping out the few cases that will be identified.
in Arkansas, TB disproportionately affects African Americans, Pacific Islanders, and Hispanics. The most at risk of severe complications are babies and young children, the elderly, and the immunocompromised.